Thanks very much. Now I'm going to introduce our panel, make a few brief comments, but then really it's the discussion of the panel I think that's most important here. But first of all, I think, it's been very clear to this morning that regardless of what is going to happen politically with health reform, health IT is here to stay. It's been here. It's here to stay. The question simply becomes, what role is the government going to play in the development and the expansion of health IT in the healthcare sector? And as we know, that can be good, bad, or indifferent. And I think we've got a really good panel to talk about that. And I wrote down some questions listening this morning to a couple of questions I'd like to pose at some point that popped up. So what I'm going to do is just introduce our panel and let each one of them say 5 minutes, and then we'll kind of dive into the conversation. Our first speaker is Brad Thompson. Brad's with Epstein, Becker & Green. He's got an excellent vantage point for us this morning because he does focuses on FDA regulatory work in medical devices, and of course technology is looked at as a medical device in many cases, and oftentimes actually has to be approved by the FDA. So I think his experience over the years in terms of working with the FDA is excellent. We haven't really heard from that yet this morning. So I think that's going to be an important thing for us to listen because, again, if you're a device company, if you're an IT company, this is a world you're going to have to know and understand, and how that world works together is important for adoption. Our second speaker is Harry Greenspun. Harry is a physician. He has most recently just came to Deloitte Center for Health Solutions, where he's advising them on health IT issues as well as clinical transformation. But really what provides him with, I think, a very hands-on experience in the development of HIT is he's Chief Medical Officer previously for Dell and for Northrop Grumman. So he's had that opportunity for companies who are specifically working in this area, and so I think he's really going to be able to provide that point of view for us. And then our last speaker is Merrill Matthews. Merrill, many of you may know, is literally one of Washington's, I won't say old, but top health policy thinkers and analysts. He used to start as a child. So he has been around for a while, but like I said, started very young. He's now a resident scholar at the Institute for Policy Innovation. Previously, he was executive director for the Council for Affordable Health Insurance. And so literally he's had the opportunity to look at healthcare, all the questions that are out there, including issues around health IT, and what perhaps direction we might go in as far as change is concerned. So again, very well known, one of our top thinkers. So with that, I'm just going to turn it over to Brad and we'll go down the line.